I think everything that happens in government is ultimately about our values. But boy, nowhere do you see it more than measure the values that a country has by how it treats its mamas and its babies. And the United States, for 25 years, has profoundly failed on this front. We have failed our mamas, we have failed our babies, exactly in the ways you talk about. While countries around the world have had more and more mothers surviving childbirth, here in the United States, we're one of only a handful of countries where it's actually gone down. And there is a specific problem, as you rightly identify, for women of color, who are 3 to 4 times more likely to die in childbirth. And here's the thing. Even after we do the adjustments for income, for education, this is true across the board. This is true for well-educated African-American women, for wealthy African-American women. And the best studies that I've seen put it down to just one thing: prejudice. That doctors and nurses don't hear African-American women's medical issues the same way that they hear the same things from white women. And we got to change that, and we got to change it fast, because people's lives are at stake. So I got a plan. Okay. And here's the plan. I know there are a lot of people, and probably a lot of people in this audience, who've been working on this issue. There are a lot of good ideas about how we could raise awareness of it and other kinds of things we could do to study it. But I got another approach that I want to use. I want to talk to the hospitals, is where most of these births take place, and I want to talk to them in the language they understand: money. Because here's the deal. Yeah, because here's the deal. Right now, the way that most medical procedures are treated, including those of childbirth, is that hospitals and the doctors who work for them and the nurses who work for them, that hospitals get fee-for-services. So they get something for the delivery room and something for the recovery room and something for all the different parts, right? And they get it no matter what the outcomes are. So we have an innovation that's been going on now in medicine for a while called bundled payments. And the way it works is, say you go to have your knee replaced. The hospital just gets a lump of money, and then the measurement is, did the person get a knee that they can walk on that's pain-free? Well, here's what I'd like to change right now in maternal health. And that is to say, the hospitals are just going to get a lump of money. And if they bring down those maternal mortality rates, then they get a bonus. And if they don't, then they're going to have money taken away from them. See the hospitals see it as their responsibility to address this problem head on and to make it a first priority. And the best way to do that is to use money to make it happen, because we got to have change, and we got to have change now. So that's my plan.
Thank you.